Good evening. I'd like to welcome you to a Speak Sooner community education program. This evening, we're pleased to present Improving Healthcare Communication. Speak Sooner and Adirondack Health meet the challenge. I'm Bernard Bandman, and I'm Executive Director of the Center for Communication and Medicine in Bennington, Vermont. The mission of Speak Sooner is to prepare patients facing serious illness and their family for honest and timely conversations with healthcare providers, leading to decisions about care that honor a person's values, priorities, and goals. Before we meet the panel, I'd just like to take a moment to thank the sponsors who made it possible to present this Speak Sooner program. Our lead sponsors include Adirondack Health, the AOCNP Foundation, Bennington Potters, Kathleen Blatz and G.R. Page, DePaula Ford, and M&T Bank Foundation. Our signature sponsors include someone who would rather remain anonymous, Constance West, Kurt Merrow, D.B. McKenna and Company, Dr. and Mrs. Ronald Mensch, Dr. Robert and Alice Peslich, Green Mountain Tile, GVH Studio, Jason Morrissey, attorney at law, Jeanette Roper, Laura Moore, Mary and Kevin Daly, Michael Keene, Shelley Pazer and Gary Baranowski, and the Winburn Law Office. Well, before we actually, we know who the sponsors are, but now we'd like to introduce you to the panelists for this evening's program. First, Dr. David Mastrianni. Dr. Mastrianni is oncology consultant at Adirondack Health at Saranac Lake. He's a graduate of Princeton University and Albany Medical College. He was a clinical and research fellow in the Division of Hematology and Oncology at Beth Israel Hospital and Harvard Medical School in Boston, and has been an instructor in medicine at Albany Medical College and Harvard Medical School. Dr. Mastrianni has published articles on the human experience of medicine and research on the developments of testing and screening related to oncology with SARS-CoV-2. Dr. Mastrianni has almost 40 years of experience in the practice of oncology. Sara Ames. Sara is an oncology certified nurse practitioner at Adirondack Health Medical Center in Saranac Lake, the only hospital, she notes, located in the vast 6 million acre Adirondack Park. Sara was born and raised in Saranac Lake and is committed to serving her local community. After completing her BSN at New York University, she worked at Memorial Sloan Kettering Cancer Center in New York City. After moving back to her hometown, she was offered an opportunity to become the lead oncology nurse practitioner at Adirondack Medical Center's oncology department. She went on to complete her Master's of Science in Nursing from Thomas Jefferson University in Philadelphia, Pennsylvania, in the oncology program. She has over 18 years' experience working in the field of oncology as a registered nurse, nurse practitioner, and program director. Jessica Shumway. Jessica is a cardiology physician assistant at Adirondack Medical Center here in Saranac Lake. She previously worked in advanced heart failure at the New England Heart and Vascular Institute in Manchester, New Hampshire. She holds a certificate in palliative care and serious illness from CSU Shirley Haynes Institute for Palliative Care. She is also a volunteer with High Peaks Hospice. Her clinical interests include heart failure management and palliative care. She lives in Saranac Lake with her husband and black lab, Nora. Mary Smith. Mary is a registered nurse and a 3-time cancer survivor who is currently in treatment. She was born in Oneida, New York, and lives in Saranac Lake. Mary attended Paul Smith's College and North Country Community College. She is the mother of 2 and grandma of 2 and has 1 chocolate lab. She feels like the luckiest person on earth. So before we begin the actual program, I'd like to remind everybody that we are taking questions, and you can submit them through the form that you received with a link to this program, and you can also submit them on the Q&A on your screen, and we'll try to answer as many questions as time allows. Well, now I'd like to have all of us view a video on the challenges of healthcare communication that will set the stage for our panel discussion. So let's watch.
We've got all these different amazing treatments that we can access. We don't have every one of them here, but we have a lot of it here, and it's an amazing array. So that's the difference. With that complexity has come an increase in the complexity of the discussions you have to have with patients about every aspect of their illness. So years ago, the discussions could be very emotional, very heart-rending, but they were often much simpler. It was, which of these simple treatments are you going to take? And if you're talking about advanced cancer, it was going to be, okay, are you going to take one of these chemotherapy treatments that are really pretty harsh? We don't have good anti-nausea medicines. You're going to be really sick. Or are you going to go for comfort care, for hospice? And the hospice movement was developing at that time. Now we've got this gray zone that can extend for years and years of patients' lives. And so we have all this technology, all this gray zone, all these discussions to have with people. We have the same 20 minutes. So this is the challenge.
As soon as you sit there and they say to you, you have cancer, that's all you hear. You don't, it's like Charlie Brown, wah, 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 after that. So you leave, and then your family has all these questions, and you have all these questions because all you heard was cancer. You didn't kind of hear any of that. So I wasn't prepared. This time I was prepared to know and what to ask. But at the beginning, I had no idea.
Sometimes those communications can be difficult and scary. We can have our personal feelings mixed in, and it can be hard to separate those personal feelings sometimes with the people in front of you, whether that be coworkers or whether that be patients.
A lot of physicians have gone to medical school to focus on the details of providing the best medical care, but sometimes what gets lost is what the patient preference is.
When we started talking with SpeakSooner, it was immediate. I knew that we were speaking the same language and I wanted to work with them because the department that I've been so lucky to work in has, I think their strength is their human side of care, and I wanted to find a way to maintain it and to teach others. We had other staff members that were new to the specialty, and it's just something that I feel very strongly about, that is something that is at stake in healthcare today, is just the true, honest communication with patients and family.
So now what I'd like to do is, with the panelists, expand on what they shared with us in this video about challenges. So I'd like to begin with Dr. Mastrianni. So in addition to time pressures, can you tell us more about the communication challenges that you face in today's healthcare climate, especially in discussing options when treatments fail?
Before I answer your question, Bernie, I just would also like to make one point for the people listening here, and that is to clarify a little bit my role in this. I've been fortunate to act as the oncologist throughout much of this project, but I wouldn't want people to think that I really did the work. The work of this project, and it's absolutely critical, was done by obviously you and your staff and all that you've developed, and then really by Sara and her team here. So I think it's important to say that as the physician, I've been the beneficiary of it, I've been supportive of it, but I didn't do the hands-on work involved in setting all this up. But this is the challenge. The challenge is we have all of this complexity in our lives, we have all of this complexity in medicine, and how do we handle that when we're talking to patients in a very time-pressured situation? You have very little time. And as physicians now, we have more and more responsibilities with things like the electronic medical record, all the data keeping, the billing, and all these other things. So how do we face that challenge of more and more information, more complexity to the decisions, and less time? And so that's the challenge. And that's the challenge that Sara recognized and that healthcare providers all across the world recognize. And Sara stood up and said, we're going to try to do something with it, and fortunately found you. And so we've now had this really wonderful program. So absolutely, that's the challenge.
Thank you. I'd like to turn to Mary. As a patient, you're also a nurse, but now as a patient, what have been the challenges you faced as a patient in communicating with healthcare providers?
I think years ago when I was first diagnosed, I went in not knowing anything and I was scared to death. Once I built a rapport with the oncology department and I knew that what I said was important to them, that's when the relationship was built. And then I felt comfortable to ask them questions of that my family had questions. So now when I go to a doctor, I know what I want to ask when I go in there, because if you use the SpeakSooner guide, it prepares you with your questions before you walk in, because it is such a short amount of time, but you have to do the work on your end before you go into the doctor, because you only have that little bit of amount of time. But hopefully the doctor will answer the questions that you had. And that's what builds the connection for me with a provider. And then I trust them. And I think that helps you to heal and to get better.
Mm-hmm. Yeah. I mean, again, we're really talking about on all sides. You know, you also mentioned time and the need, the importance of trying to prepare. And sometimes you don't even prepare for, right? Because you haven't gone through the door. But it's, again, these challenges that patients and the providers face every single day. And as Dr. Mastrianni said, it gets even more complicated. I'd like to ask Jessica, and because your practice is in cardiology. So what have you found is challenges to communication in your specialty?
It's interesting because the challenges are very similar to oncology. When you walk in a room and tell someone that they have heart failure, they don't hear anything else. And often the challenge is that patients are fearful and overwhelmed. And we ask them, do they have any questions? But they just don't know what questions they should be asking.
Yeah, that's huge. And like you say, there's this similarity in many different specialties. But we have you here, you know, your expertise and your experience and hearing the same thing. I mean, when you just said, you know, do you have any questions? And I'm sure all of you have this experience. And you know, it's like, I don't even know what to ask at this moment in time. You know, and I know Mary referenced the guide, which helps to prepare patients to think about these things. But by and large, it's like people just go blank. They don't hear anything else. You said it, Mary. You hear the word cancer, and it's like blah blah blah. You know, so this is it's a huge challenge, certainly at the beginning. And what gets built from there really becomes the key around communication. And we'll talk a little bit more of that in a moment. But I wanted to ask Sara, while on the subject of challenges to communication. So from your experience as an oncology nurse practitioner, can you talk about what you've observed as barriers to effective patient-provider communication?
So I think what's different in my role is time is not the biggest barrier, but I would say it's trust between the patient and the provider and between my colleagues. And by that, I mean there's a level of permission that I think the Speak Sooner program has allowed us to have, which has been a very interesting sort of realization, where I have the permission from the physician that I work closely with, and the nurses have permission with us to really engage with the patients in a way that's gonna help everybody involved in the care. So I would say that in the trust factor is something that's also been more noticeable since COVID, honestly. Just people feel a little apprehensive. So building that trust has been a barrier.
My observation, just to add to what Sara said, was that as we started to use the guide within the office setting, and it became a tool not just for patients, it became a tool for us. And that was, I think, a real critical step, was when we all started to say, did we use the guide around this person and their illness? And how did we communicate with each other? Were we all on the same page? And were we all bringing our different viewpoints to the patient and giving them more opportunities to talk about this? Because they do spend a lot of time in our world with nurses, and that was just a very helpful thing. But even people at the front desk, that interaction brings a lot. And so when you have everybody on the same page, that really made a big difference. And Sara was really key in organizing that for us.
Yeah, well, it's good you're raising this, this issue around trust and what you built between yourselves as a team, right? And how that gets reflected on how you communicate with the patients and the families that you're caring for. So it's important. And now what I'd like to do is take it another step. And in this instance, I really want to be able to share with the people who are attending another short video. And this video really aims at looking at how Speak Sooner, and you're talking about this, how this program has influenced your practice, but how has it benefited patients? So what I'd like to do is show that clip, and then on the other side, we'll talk some more about how this actually benefits the patients in your practice.
It gives you power to take control over what's happening with you. And the guide brings up questions that you don't think about, but it makes you think about. And that's pretty powerful too, to go there, because you're just so super hyper focused on one thing, but there's so much other stuff that is involved and the guide brings light to all that, because it's something you're thinking about in the middle of the night. Oh my gosh, I gotta, but that will, and you can just keep looking through the guide and, okay, I handled that. And, I'm all about steps, okay, I took care of that. Let's do this now. Okay, we took care of that. And yeah, it's very helpful.
So, a lot of the time we can say, yes, we did use the guide or the influence of the guide. So, any kind of material, any kind of educational material, it has value, but really it's the relationship and the person doing the educating and the whole back and forth. That's what matters. We know there's a lot of pieces of paper out there, and they can be meaningless without the relationship.
I think I would introduce the guide to my family members after I filled it out. And then I'd say to them, is there anything else that you need to know? Because I am a family unit. It's not just me. One person just doesn't have cancer. It's the whole family that has cancer, and your friends have cancer. And some people don't want to be around you because they don't know how to handle it. And I use a lot of humor with people because it puts them at ease, because people are like, oh God, she's got cancer. She's bald. You know what I mean? I'm like, yeah, how do you like my hairdo today? You know, because people are nervous about it. So if I answer all these questions and I'm comfortable with all this, it's going to make them comfortable with it, or more comfortable. Even if I'm lying, I'll make them feel more comfortable.
There's Mary. Yep. It's great because you're really bringing us right into the lived experience of being the patient, right? And what it's like for you. And of course, you just talked about what it's like for your family. And so, you know, we were talking about the guide, and, you know, folks who are watching may or may not be familiar with the guide. But I would like you, if you can, Mary, to talk even a little bit more specifically about some things or something about a topic in the guide, something that helped prompt you to think about something that you might have not on your own, you know, thought about right away. And it really helped you in terms of some of the conversations that you had with your team.
The biggest thing for me was I'm a caretaker. As a nurse, as a mother, as a daughter, I want to make sure everybody's okay. So for me, having cancer, oh my gosh, my mother was so upset. My kids were, 5 and 7. How can I learn about this and about how to talk to your family and what kind of questions and planning? So when they're asking you all these fire of questions, you've already got the answers. I didn't think about those before, but as I'm looking through, like the first time I had cancer, I didn't have that guide. But when Sara gave it to me this last time, I'm like, oh my gosh, this is stuff that took me forever to figure out. If I'd have just known at the beginning, it would have been an easier ride the first time. So that's the thing, and just how to, the stuff that's going to come down the road. I'm a single mom, I got to go to work. And they adjusted to that. The oncology department knows me as a mother, as a nurse, I got to go to work. They schedule around what you do. And it's just, you trust them, they trust you that you're going to, do what you're supposed to be doing. And you listen to them, they listen to you, and together you make decisions. And that guide helps you to categorize it and just do one thing at a time. Because when you first are diagnosed, whether it's with heart disease or cancer, you've got all this stuff coming at you, and it lets you do one thing at a time. I just did 1 page a night because it's so overwhelming. And it's almost like a diary, and it just makes you reflect on everything that's going to be coming at you, so you're not so surprised, because there's a lot of surprises. And I have people that are going through cancer that call me, oh, Mary, what am I going to do? This and that. I'm like, okay, listen, we're going to talk about this. And this is what because they don't know that your mouth gets sore and everything tastes funny. And, but I know that. So I'm helping people, but I learned to do that through the guide and through working with this amazing oncology department. So it's amazing. I'm sorry, I'm wordy.
No, but again, you're telling what really took place with you. This is the 3rd time for you,
Yeah.
So from being really unprepared to being somewhat unprepared, and then, now being more prepared. And that's the value. It's a value to you, it's a value to your family, value to others who look to you, who lean on you about this. This is no small matter.
I am beyond honored to be sitting with all these people, because they have kept me alive and they respect me, and I respect them more than anyone will ever know. And it makes it, if you believe in your care providers and you feel seen and heard, and that is a huge thing with physicians. If I don't feel seen and heard, I can't connect with you. I don't feel like I'm going to be okay. But that connection and feeling safe to ask the stupid questions, because a lot of people think, oh, that's stupid, I can't ask that. I ask so many stupid questions, it's not even funny, but I feel empowered by that. And they allow me to do that. And that's super important, to have some sort of control during an uncontrollable situation.
Yeah, very well said. So what I'd like to do is now, I want to ask Sara. Because Sara has been, as Dr. Mastrianni said, such a key component of this program. And I'm glad that you said the word tool, Mary, and Dr. Mastrianni used the word tool. And you earlier said, Sara, there's so many papers that get handed out and handed out, as opposed to something that could be used as a tool to help facilitate the communication process. So let me ask you this question, and it's related to what I just said. So from your experience now, introducing the guide and the program, how have you seen it beneficial in the care of your patients?
Well, we've tried it out in a couple of different ways, and initially it was more of the tangible presentation of it, which can be very helpful in certain situations where you're trying to emphasize something specifically. But as we continue to work with it, I found that I liked to sort of incorporate the guide in my own self and didn't utilize the actual paper guide, and had some questions that I knew I wanted to ask to help prompt the conversation. And so, and I think I'm quoted as saying, I am the guide.
Yeah.
And so I said it again.
You are the guide, you are the tool.
And I think with that, I think it seems 100% of the time people really appreciate you asking them questions and really wanting to understand what it is that they don't understand and helping them bridge that gap. And I think that it's again, it's a tool. It helps prompt conversations when sometimes you need a little help with that. And same for the patients, when they need some prompting, it gives them that opportunity to focus on something. Because again, as Mary has stated, it's extremely overwhelming, and all of this takes time over time.
Okay, no, I'm just, if you're noticing, I'm looking down at my phone because I'm getting questions that sent to me from the Q&A, so I don't have to start playing with my technology lack of, what can I tell you? So I want to pose these questions, and this is a good time. So how do you approach serious conversations like treatment decisions, prognosis, with patients who may have a lower health literacy level, to ensure that they truly understand and they can feel empowered? So let me just toss that out to anyone who would like to take that one.
Oh, go ahead.
So as a nurse, I work with individuals with developmentally disabled. So I have to, when they have something serious coming up, I spend days explaining stuff to them, because I want them to go into what's going to happen to them, not being afraid, to know what is coming at them. And, if I have to use different terminology, because they'll just sit there at the doctor and shake their head, but you have to explain it. And then I have them explain back to me, what did you hear me say? So I know that they got it, because not everybody is at the same intellectual level, but they can still get it. They can still get it just as well as I get it. It's just in a different way. And a doctor that is on point is going to know how to get that point across, because there's nothing more fearful than going in to have something done to you and you have no idea what's going to happen. You should know what to expect, not to be lied to. Yes, it's going to hurt, but it's, we're going to do it for a good reason. And so I think that's very important.
Yeah, no, it's true. Maybe I'd like to ask the others too, because you're talking about medical language is for actually most people a foreign language. So it's the question coming here is like, how do you address that when you recognize that someone is really not understanding, not comprehending even the language around a diagnosis or a treatment plan, no less a prognosis. So, who else would like to address that?
Well, I was just going to comment on the first question in the guide is, what is your understanding?
Mm-hmm.
And it's my routine question. You have to gauge where the patient is at from the very beginning. And I think that tells the clinician what is their understanding. And I think we have to speak their language. You know, however they communicate, you know, you just have to adapt in that way and use words and body language that they understand. So I think that always starting off with what is your understanding is a good place to start, engage the gap.
Mm-hmm. You learn right away, don't you?
And I think the notion, just to expand on it, is that this is something that the whole team can participate in. And so we can present the information a little bit differently, Sara and I, but also the nurses and the other people that have built up trust with the patient. So the idea that that it just needs to come from one source, I think, is also something that the guide has been very helpful with, because it's really given permission for these discussions to take place in a lot of different times, over different times, with different people on your healthcare team. And that really adds a lot, because in any complex activity, you don't understand something the first time, and particularly if you're out of your field. So I think the guide has really given us the chance to have all the different team members be on something of the same page as we talk to patients, bringing different perspectives to them.
Yeah, absolutely. I mean, I come back to what all of you have touched upon. You used the word trust, and it's the same thing you're talking about, Dr. Mastrianni. It's, because this program is over time. It's not like, oh, you come in here, here's this guide, and let us know if you have any questions. That's not how it works, even though Sara's now become the guide.
Tool.
But that's, when we heard you say that before, because we had that on video, it meant so much, because it meant that what you were doing was becoming much more integrated into your practice. And not that you weren't caring, empathetic, clinicians, but there was a framework that was being developed where there were these reminders, you can say, these points at which, because of the topics in the guide and how it works, that these questions, these concerns were brought up over a course in time as things change, often does. So the question I have now is circling back to building trust. And maybe that sounds a little bit abstract, but I think the guide has done that. But how do you do that? How do you help patients to build trust with you, and so that they would hopefully become much more open about what their questions, their concerns are? How do you? Any thoughts on that? How do you build that trust for patients?
Well, okay, I'll go. Because I saw Sara set it up. And I think the key thing that she did was involve everybody on the team in the guide. And so we started having meetings about patients and how we were using the guide. That she organized all these things. And it was really remarkable. And so actually, I have a little story. My son, who's a lawyer, had to spend one summer as a hospital transporter because his mother told him he had to. And it was a great job for him. And one day he came to me and he said, these hospitals are amazing places. He said, everybody has a job in the hospital, and then the nurses do everything. And he's right, and so what we found in our own unit was that by talking about the guide and talking about individual patients and how we were using the guide and bringing in the nurses and our social worker and the front desk staff and all talking about where things stood, that was a tremendous value on our side. And so people were hearing the same message in different languages from different perspectives from different people. And that's what Sara set up. So thank you.
Wow.
Yeah, I mean, I'm here again, I'm thinking about trust, and that what you were saying, each of you, is that you're listening. You're asking them questions like, what do you understand? What your concerns are? And you're listening to them in their own way, in their own perspective, and what they're delivering to you. And there's a certain level of empathy that comes with that when you do that. And so I'm just thinking, as my background as a psychologist, it's an element in really building trust when you really listen to what someone is saying, giving the opportunity. It's back to what you said, Jess. You have any questions? That this is a process where the guide is a tool, and there are many, many opportunities to listen to what they're saying because they're encouraged to, and then respond accordingly. And it's back to relationship, and it's back to trust. And every person, every clinician, every patient wants that, right? But there are more challenges, as we've been talking about, in this current healthcare system. So you have to make it integrated into how the practice works. So I'm kind of talking about trust as well, but I wanted to go on to the next section. And this actually is something that you all at Adirondack Health has shared with us, the SpeakSooner team, because one of the things that we know is that this SpeakSooner program was intended to activate patients, right? To identify, to talk about what their questions and concerns are. But what was a bit unexpected, and actually you've all talked about it already, is that the influence of the guide, what it has on the oncology team itself, the influence. So I'd like to take a moment and actually play a video that has to do with the benefit to healthcare providers, SpeakSooner's benefit. So let's watch.
A lot of people feel like adding anything else on their plate is impossible. And I understand that reaction. And I think that it's true. I think that people are maxed out. There's not a lot of time. And so how do you, get them to understand that this is something worth their while? I think showing them that the preparation is worth it, because then it makes that time, especially with the physician that is so tight and so precious, more efficient. So I think really emphasizing that this could make your day-to-day workflow and work life better, but there's going to be a certain amount of investment in it.
It's always easier to give one more treatment and not have a serious discussion. It's always easier to do that. You can go in the room and say, well, your blood counts are good. We'll give you one more treatment and then we'll see where you are next week. So it's always easier to kick the can down the road than it is to have a serious discussion. Now, if the person needs to kick the can down the road, that's okay. But if you're kicking the can down the road because you haven't got the system set up and you're not prepared to talk to the person about a serious issue, then that's not the right thing.
When you introduced the SpeakSooner program to me, I felt immediately it seemed like a missing piece that we had in oncology. We lacked the ability to have these conversations with patients up front and early in their care, to get them thinking about where they wanted to go in their life, what their end-of-life decisions looked like to them. And it sounded like a great opportunity to introduce folks and how to have those conversations so that as things developed in their care, one way or another, they were prepared and their clinicians were prepared.
It's great if you have a physician who's communicating very well with the patient and family, but you also need everyone else on that healthcare team to be understanding and speaking that same language. And that's where I think the Speak Sooner can help get everyone else up to speed on what the provider and the patient are talking about.
And this is a value that we all share, is that good communication is key amongst ourselves and with the patients. And we're always talking about our conversations with the patients. I think it is our culture that we all have to be honest, empathetic, and we need to share among ourselves in a way so that everybody that's coming in and out in terms of staff understand where we're at.
And I can pretty much rest assured that I'm going to go in there and talk in the right way, or head the discussion in the right way, because the staff's already told me what to do. You know, they haven't told me what to say, but they've told me which direction the patient is ready to go in, and that's what it saves. And I think that's a tremendous benefit.
Okay, we're back. So we got again. When you look at this, you chuckle, right? But it was not something we were expecting in terms of our collaboration to hear this about the effect on the staff. So maybe this, and you said it in the video, but I'm wondering, Sarah, is there anything more you want to share with the people attending about how this program has really influenced your staff, the clinicians?
Well, I think it's important for the audience to know that this happened over a course of 2 years, where we really examined how we practice. And I don't know how often that happens, but it was self-driven. It wasn't somebody else telling us we needed to look at how we operated. So we focused on new oncology patients from the moment they walked in the door. And I think understanding your process and understanding where it works and where it doesn't work was something that I did not anticipate. It wasn't really, my initial goal, but it's what has brought us to this point where, as a staff, we have a much better understanding of all those steps that we take and where we interject. And all of this takes a little bit of preparation all the time, so that you build that trust over time, and that when there's big transitions, they have been prepared and we are prepared. So I think examining your process in any practice is a great exercise, and can enable you to pick apart what works and what doesn't, and then try to make the changes so that it works better for everybody.
Yeah. So for you, it's like you've used this in a way that you've been able to really look more closely at perhaps even more difficult patients, or patients that are dealing with more difficult issues, and finding that it has been helpful in terms of generating more conversation about topics that are often like prognosis, right? They're often very difficult to discuss. They're uncomfortable. And yet what I'm hearing is, as a staff, because you're talking among yourselves, and that's generating probably suggestions, ideas about how to approach a particular patient, that it's been helpful in that way, So that I don't want to kind of be out of line here and assume that, but I kind of know that. But I think the people who are attending should really be able to appreciate that there are cases that are very difficult. And the fact that you talking about it among yourselves, you even convene a meeting where you talk about this, that really helps prepare you, the health care providers, to have these conversations that can be, really hard things to talk about, really.
There's a lot of things you learn about the patients when you hear what other people's experiences are with them. It's not just your own. I think that's been a big benefit, is you hear what the nurses are telling you when they've spent 6 hours of their day administering the chemotherapy, that has really helped us understand more.
Yeah. I was just looking at my note, but everyone just heard Dr. Mastrianni, you talking about kicking the can. And it's really such a good in a sense of image and how you put it. If the patient wants to postpone really addressing certain issues, that's fine. But for you not to be the one to avoid an uncomfortable conversation. So I'm wondering, with that in mind, how working with your staff, back to, this is, we're talking now about the benefit to the providers, how that has helped you, and you kind of alluded to it in the video clip, but how it's helped you to have what I would call more difficult conversations, transitions in care, prognosis. Could you talk a little bit about that?
Well, sometimes it's dictated by just the reality of the illness, and then you have to have these difficult conversations because something has changed in the illness, and that forces you to act. But there are also many times where the change has occurred within the person, and I may not be aware of that, but the nurses and Sara may be very well aware of it. And so there have been times where they've actually come and said, look, this is getting really hard for this person, and we need to they really want to talk about it. And so then we've been able to talk about it, and that's been a very important example. In fact, I was remembering one particular person who had been going through a series of treatments for a really long period of time. We had multiple discussions. The guide had been involved, but the patient ultimately decided they didn't want any more treatment. And it was not a surprise, but the time when the person selected to make that decision was very much their own. And so I didn't know when it was going to be, but they made that decision. And afterwards, I realized I was never really involved in the exact time. I had been involved in the discussions all the way up, but the exact time they ended up setting up with the nurses and with the people that they really, really trusted and bonded with. And it was really, in retrospect, an amazing thing. So I think that's really allows the patient and sometimes it's their family that I don't see, but the nurses see while they're giving treatments, or the person at the front desk says, we've been getting all these calls, and that triggers off a discussion, So there's a lot of clues in there that I would never see. And that's what this guide has really, I think, how it's really changed the whole staff. And really that's due to the work of Sara bringing it forward, being the guide and talking about it and bringing it forward. So a remarkable thing.
Yeah. Yeah. I wanted to ask Jess, I want to turn it over to you, Jess, because you're cardiology. So it's like, where does this all fit into this? But it does fit because it has to do with patient care, and it has to do with job satisfaction, and it has to do with, and it's already been noted, and it's no small thing in today's healthcare, about efficiencies with workflow. So I would just ask you, in terms of your specialty in cardiology, so how can you see with your staff the SpeakSooner program working within your practice?
Yeah, that's a great question, because I think a lot of times these conversations are focused on oncology, but anyone who treats patients with serious illness are going to be facing these same conversations. I was fortunate enough to have an experience as part of a previous advanced heart failure team to have a palliative care physician embedded as part of our team. So I've seen this work very well. We talk about things like being prepared, having a visit that's focused on what is your understanding, what questions do you have, what are your goals, what do you care about, what do you want for the amount of time that you have left. And that made it much easier when those same people were admitted to the hospital, had a crisis. Or as Dr. Mastrianni pointed out, sometimes it's not the disease process, but the person themselves who make the decision. And it was really interesting to hear a lot of people say, Dr. Mayer told me this day would come. And it really puts everyone on the team on the same page. And when I came to Adirondack Health and I heard about the Speak Sooner program, I said, this is what is missing. We are a very small cardiology practice here. And so we don't have the benefit of 25 cardiologists and a cardiologist who happens to also have a fellowship in palliative care. But that doesn't mean we can't do those same things. Start talking about these conversations early and often. Involve everyone in the care. We have amazing nurses, amazing medical office assistants, and reception staff that, as Dr. Mastrianni said, they give you clues that something's going on, whether or not that patient will bring it up to you. And we can use the guide to help prompt some of those more difficult conversations and help patients feel more prepared about what are the questions I'm going to be asked, what are the things I should be thinking about, and how do I want to answer them? And instead of trying to put them on the spot in the office, allow them the time and space to think about those things beforehand. Allow them to bounce ideas off of other office staff. Oftentimes it's the nurses, or in our office, it's the medical office assistants that are the more approachable ones. They're the ones that'll say, what did the cardiologist say? What did he mean? And so I really think having a communication tool like the Speak Sooner program can benefit patients and the whole office staff about getting on the same page and being able to share that information within the team and within the patient family structure to make sure that we are aligning care with what the patient wants to do.
The applicability is absolutely there, and we'll talk about it in a moment about your specialty, even other specialties, which Luke Meissner, who's on the video, had talked about. But the thing that I really wanted, and you've said it, but just to really emphasize that what you've been talking about, the experience, and it's, again, unexpected, we weren't thinking in these terms, is about how the communication between the members of the team has really, not that it wasn't there, I don't want to imply that whatsoever, but there's something about this program that really has prompted, right? Maybe given permission in a way, for more exchange around the patient's care plan, what you're hearing. Dr. Mastrianni said, listen, a lot of these conversations, they've happened before me. I learn about it. And then it's so helpful to be able to have the conversation as a physician with the patient. So this to me is a really important piece of this, especially in today's healthcare world, that as a staff, there's more of this teamwork, and the word team these days is really huge in healthcare, and having those kinds of teams working together. So I'm just taking what you already said. I guess I'm repeating what you're saying and kind of consolidating that, because I don't want this to be lost on those who are attending, who are watching this. That there's another piece to this. Yes, patient care is critical. The value of this program and helping patients to encourage them to be prepared to talk about these things, but the effect it's having on the staff should not be lost. Now, we're going to be talking about that in a moment, because we have another video that we're going to be looking at, and this video has to do with the benefits to the healthcare system. Speak Sooner's benefit to the healthcare system. So let's take a look at this video, and we'll talk about this on the other side.
So with SpeakSooner, involved in Adirondack Health Oncology now, I think it's provided a great space for patients and clinicians to have these conversations early in a cemented way in our process.
It is very interesting that there's a significant reduction in our patients being hospitalized. And I think that when you have good communication and a good rapport and trust with patients and family, all along the way, the decisions that they are faced with, which are very difficult, I think are being made more soundly.
Focusing on keeping patients out of the hospital is both good medicine and makes good financial sense for the hospital. When you have a framework and a background to build on, it makes those conversations more efficient, right? You get your points across, the patient gets their points across in a more timely manner, and you can hopefully come to a resolution and a plan of care with the patient in a quicker time frame.
But I would love the SpeakSooner program to be part of that, because I think that would be so helpful for everyone to be on the same page. The primary care providers, the oncology team, the cardiology team, the inpatient team, the outpatient team, the ER. We could unify around that SpeakSooner model. That could be really helpful.
Okay, so this is a big one here, the healthcare system, right? And everyone look, sitting there, and you're all at Adirondack Health. You're in the conference room, and we know the what's happening today is just such an overburdened system. It's you've all talked about it. Things are coming at you, whether it's electronic records and the scheduling, the time, and so forth and so on. So this is not new to you, and it's not new to patients and the public in general. So there's often this throwing up of hands, like, nothing could be done, in terms of the system itself. Nothing really. And I think what we're learning, and listen, I wish we could say we had hard data to back this up, but at this point we don't. But we have enough to have a conversation about how the SpeakSooner program may be able to influence the healthcare system itself. And so if we're talking about hospitalizations, and you provided some data, Sara, and it showed that there was a drastic reduction by half, actually, since the time SpeakSooner began and before, in terms of hospital admissions. And Luke Meissner, who is on the business side, makes the comment, fewer hospitalizations makes good financial sense to the hospital, to the system. So I just wanted to kind of hear some of your thoughts about the relationship between SpeakSooner program and how it might be able to help with the efficiencies, perhaps, in the healthcare system, workflow in the healthcare system. Some of the things that, just a chance just to kind of almost like just put it out there in terms of what you think is that relationship and how the healthcare system could benefit from this kind of intervention across the system. And you, Jessica, we're talking about that. But I just want to put it out there. Any thoughts about that? Because I think that's an important piece.
Well, I'll start by saying that I think what's happening here in real time is what I would hope could happen in other places, which is you start small and you build out. So we started in oncology, and the program has now moved to cardiology, heart failure clinic. And you can't, I think it's very hard to approach it as an institution in a, sort of trying to have it implemented across the board all at once, because I just don't think it would be successful. So I think it's little steps at a time. And I think that because things are more advanced and complex and highly specialized, you got to bring it back to the basics. And the basics are, do we know what's going on among each other? Do patients understand what's going on? And basic communication is the key for many things. So I think it's the ripple effect. And that's what we're seeing here. And I hope that it expands further. from cardiology to the other departments, and maybe in time, the organization will have a model of care that works for everybody and reduces unwarranted admissions and is financially sound.
Mm-hmm. I was asked Dr. Mastrianni about this. Again, you're not a hospital administrator, you're not doing that. But what we do know, it's common knowledge that because we can see it in the mass media, press, and certainly within the profession about burnout and how there's a relationship between job satisfaction, something we've been talking about within your practice, right? That there's with the engagement. Nothing's perfect, but there's something going on that really has made everyone feel more like a team. They're there for each other, which would increase job satisfaction. And then looking at that, right, in terms of burnout, not only for physicians, for nurses, people in healthcare in general, and the public may not know what the cost of recruitment is. Luke Meissner, when we talked with him, and you saw some of the interview, he also talked about the extraordinarily the cost of recruiting new people because people burn out. So can you become almost like put a little bit of a administrator's hat on and talk about that as in relation to what SpeakSooner might be able to do for that aspect of job satisfaction, burnout, recruitment?
Sure. So the administrative side of medicine is incredibly complicated, and trying to decide who are the financial winners and financial losers within this complicated system is almost impossible at any one moment in time. And the result for a lot of us, I've been doing this a long time, is that a lot of nonsense comes down to the clinicians, which really is just an added burden and makes people really frustrated and burned out, this whole burnout syndrome. Most of us went into medicine or nursing or social work or any other of the components of healthcare to take care of people. And when we do a good job taking care of people, then usually the financial side of it and the administrative side of it is going to be better. And you just have to believe that doing good medicine and doing good nursing and doing good healthcare is really the answer. And so exactly what Sara said, you have to build that from within. And it's not something that you can easily take this complicated system and say, we're going to put this here, or this here, or this here. It has to come from within. And the thing that we all did was we all decided we were going to go into this to help people. And so this tool gives us a chance to really meaningfully help people. And I think you just have to go on faith that by using this tool, by talking to people, by hearing what they have to say, and by doing this type of care, that the other side of it's going to work. And I think Luke will probably agree it does.
Yes. I was going to ask you, Jess, again, you're coming from cardiology, but you also have a background in the hospitalist. As a hospitalist, right? So you've worked on the inpatient side of things, and we haven't really talked about that, except a few hospitalizations. But in terms of, so again, back to the system and your thoughts about how this SpeakSooner program or something like it could really be of value with the inpatient service, that part of the healthcare system.
Yeah, so as you discussed, I've been working in cardiology, but then we had a global pandemic, and it turns out you really needed hospitalists. So I retrained as a hospitalist PA, and I actually did that from pretty much the COVID pandemic until I went full-time this past year in the cardiology office. And it's a really unique setting in the inpatient setting. You are often seeing people on their worst day. They many people with serious illness, whether that is cancer, whether that is heart disease, whether that is kidney disease, whether that is advanced COPD, they will at some point have a crisis. And that crisis will bring them into the emergency department. And it is very difficult when people are that sick and that scared to have the conversations that you really need to have about what are your wishes? Do you want resuscitation? What is the trajectory of your illness? What's your prognosis? Was this planned for? If not, have you thought about this before? That is really difficult if you're walking into a room and this is the first time you're meeting someone. That trust that we're all talking about and the rapport, it isn't there when you're an emergency room PA or physician or you're on the inpatient medicine team. Inherently, you don't have a relationship with these people. You're only seeing them when they're sick enough to come into the hospital. And so I think a system like the Speak Sooner program, if it can be utilized in the outpatient settings, this is something that we can really rely upon to either reference when people come in and say, I see your last visit with Sara, you guys talked about what would happen if this treatment didn't work. And use that as a jumping point or a launching off point to continue that conversation now that there's a crisis or now that there's a setback. And having patient feel that everyone is on the same page. I think patient satisfaction scores often are driven by feeling that everyone on your healthcare team is on the same page. And this can be a tool because, you know, Murphy's Law says you're going to come to the ER after 5 p.m. on a Friday. And being able to reference some of these previous conversations, even when, you know, Sara and Dr. Mastrianni may be at home enjoying dinner, would be so helpful in being able to say, you know, Mrs. Jones, we're going to admit you to the hospital tonight. We're going to, you know, do X, Y, or Z. And tomorrow morning, we'll talk to Sara and Dr. Mastrianni about what the plan is going forward. But you already have that trust and rapport by knowing what that conversation was on the outside.
Mm-hmm. Yeah. I mean, again, because you said, and that's important, patient satisfaction, the clinician satisfaction. Again, nothing's perfect, but you know, again, this is something seems to be a result of being able to have these kinds of conversations kind of built in through the whole process, you know, and then how it then could transfer over if someone's admitted. Again, this, and Sara made the point, it's really a step-by-step kind of thing. You know, it's like for it to move from, you know, oncology to cardiology is really it's fantastic. It makes a lot of sense whether it can move somewhere else, but it's a step-by-step process. But not to lose sight of what we're hearing about, again, the benefits to the patient, better satisfaction to the clinicians, greater satisfaction, you know, the system, you know, efficiencies, workflow. I mean, they like hearing those kinds of things, you know, as you do. But I get another question that came up, and this was from someone who's attending. So how do you approach other institutions? We know Adirondack Health has been so receptive, and, you know, we've been working together on this for some time. How do you approach other healthcare systems? You know, what would you advise? How would you do that? How would you try to interest them, so to speak, in this kind of program for their hospital or their practice? Any thoughts?
I sense Sara and Mary.
Yeah.
There we go.
There
The
you go.
curly girls.
The curly girls. You guys can go on the road.
Well, I think that, you know, my comfort level would be certainly to go into a medical oncology outpatient practice and meet with the staff and learn how they operate and what their flow is and their process, and start there and start to help them understand where they could improve and where you can insert these conversations a little bit at a time. So I think that that would be a way to start to make the influence.
Mhm.
I think going right to administration and trying to explain it and expect them to, operate it. I just don't think people are going to engage with it. We're the folks on the ground. We know what the work entails, and I think that you have to have people that are sort of natural born leaders too, and you have to identify them, and they're everywhere. And you have to have that person within a unit that people look up to, that then they can sort of work together with the natural born leader. So identifying who those people are and maybe getting their interest would be helpful.
Okay, thank you. That makes perfect sense, actually. That's what happened here with you. We're kind of this particular webinar, and I just wanted to take a moment, and I wanted to thank you as a panel, Dr. Mastrianni, Sara Ames, Mary Smith, and Jess Shumway, for just providing us with such rich material to think about and to help understand how something can be done in an oncology practice that could benefit the patients, the providers, and we think that it could also help benefit the healthcare system. So I want to thank you for that. There's also other people who have made this possible. This is a lot of behind the scenes stuff. So I want to take a moment and just thank them as well. George DeAngelis, he's the IT guru at Adirondack, and there's Jerry Wenner, who is the producer, director of the videos that you saw this evening. Louise Payton, who you didn't see, but she's behind the scenes doing all the stuff to help us so you can see the videos and all the materials. And Leslie Noyes is actually a graphic designer, and I'll show you the guide in a second. She did the design of the guide, and she designed the website. So I want to just take a moment to thank her, and Meg Cottam, because behind the scenes, nothing would happen without Meg Cottam. So I wanted to, specifically thank her for all she does. But she doesn't like to be, in front of the camera. And so I also want to just take one moment because I want to talk about collaboration. Because something like we're talking about today, this project, which turned into a program, because it was a pilot to begin with, it doesn't happen without a collaboration. And as you can see, I'm one of the members of the consulting team. Dr. Shapir and Dr. Welther have been members of our team. And we've had the good fortune of consulting to you, which is really an incredible group of medical professionals who are willing to implement a new program in an already very demanding oncology practice, And one of the things I want to go back over for a moment is that the guide is just not a handout. As you said, it's a tool, and it helps to facilitate conversations in a more organized way. And there's the guide. If you have not seen it yet, that's what it looks like. And so it's a tool that is used in summation from the time of diagnosis throughout the course of illness, and it's a reference. And yes, Sara can be the guide, because what happens is over time that the clinical team begin to take this on. And yes, it's introduced, but then it becomes part of the very nature of how conversations take place in the oncology practice at Adirondack Health. So that's a very important point, that it's just part of an integrated process of care. This is what the guide looks like. And just so you know, it's available for free online at SpeakSooner.org. And if anyone's interested in print copies, they are available, but for purchase. And you can contact us at SpeakSooner.org. And so as we're kind of winding down, I really want to thank all of you who are attending this program. If you haven't already, you can sign up at SpeakSooner.org. and you can learn about new programs. You could also actually watch some of the other webinars we've done. They're on the website. So if you're interested in those topics, you can check that out. And one thing just to keep in mind, and this panel has really emphasized it from all different perspectives, patient, clinician, and Luke actually said it himself when he talked about good communication makes financial sense, because communication is not soft and it's not inconsequential. We know that good communication is good medicine, whether you're a patient, whether you're a clinician, whether you're an administrator in a hospital. So we hope you keep that in mind, and we invite you to attend future programs, and just, you can sign up on our website, SpeakSooner.org. And like I said, you'll get notices of new things happening. And we're really very excited to continue to be working with all those people you see on the panel at Adirondack Health, and looking forward to developing more programs. So again, thank you all for attending. I wish you all a very good evening, and I hope to see you in the future. Thank you. Bye now.
Thank you.